Assalamu alaikum. Welcome back. You are listening to the Maryam Mkwanda show on Salam Media. Are South Africans becoming immune to COVID-19? Professor of Vaccinology at Wits University, Shabir Mahdi, said that some sectors of the population could have developed immune cells. A professional healthcare worker wearing personal protective equipment, or PPE, monitors a patient in a tent dedicated to the treatment of possible COVID-19 coronavirus patients at the Tshwane District Hospital in Pretoria on July 10. So experts are now sharpening their focus into the possibility that given the less than projected coronavirus infections, many South Africans could have been exposed to previous coronaviruses, thus building up some immunity to COVID-19. To talk more about this is Professor Penny Moo, who has a PhD inside SANTHE. Also a scientific advisory board member at the Wits University and National Institute for Communicable Diseases. Good morning, Professor.
Can you hear me?
Yes, now I can hear you. Thank you for joining me.
My pleasure.
All right, so please explain this to us. I mean, it's so confusing. Is this even possible?
So this is the notion of what we call herd immunity. And the idea of herd immunity is that at a certain point in any epidemic, and today we're speaking specifically about COVID-19, that enough of the population has been exposed to the virus and become infected by the virus, that enough of us are immune to the virus to build up a sort of a level of community immunity to the virus. And that results in limited spread of COVID-19 within the community. And that is the reason we believe that we're starting to see a reduction in spread of SARS-CoV-2, which is the virus that causes COVID-19 in South Africa.
Mm-hmm. So should we be concerned about a second wave of the virus if we move down to a lower level of the lockdown?
Yeah, the idea of a second wave is something that is very, very difficult for us to predict. As any of your listeners will be aware, as they watch the pandemic, as it sweeps through Europe, you'll see that, for example, Britain is currently facing a major crisis again as infections peak across Britain. And once again, they're imposing very strict lockdowns. You'll see that in parts of Australia, for example, Melbourne is still facing very strict lockdowns. In South Africa, fortunately, at the moment, as you know, the numbers of infections seem to be reduced to very low levels. But it's very difficult for us to be able to predict whether or not we too will face a second wave. At the moment, it seems that the numbers of infections are at a record low. And in part, well, to a large extent, we believe that is because our communities are being very responsive to what we call non-pharmaceutical interventions. Essentially, South Africans are being very careful about wearing masks, very careful about washing hands. And as long as we continue to behave as a country in a responsible manner, we hope that we may be able to avoid that second wave. But there's no guarantee that we will be able to avoid that second wave. And essentially, it's very difficult, in fact, impossible for us to predict if and when that might occur.
Mm-hmm. All right. And I'm sure many people are already thinking about the immunity and why didn't the disease cause excessive deaths why didn't it become more widespread? I mean, we just out of winter, so that would have been a time for the disease to be even more stronger.
Yeah, so it's a question that has perplexed South African scientists. It's a huge relief to South Africans. As many of you will be aware, we had predicted huge numbers of deaths in South Africa. And the numbers of deaths that we have experienced, though still substantial, is much lower than we had feared, to our great relief. And the reasons for that are complex. There are a number of suggestions that have been made, and scientists are working hard to understand what those are. The two major reasons that have been proposed for why fewer South Africans died than had been expected are twofold, really. One major hypothesis is that there's underlying immunity in our populations that we had not appreciated. And the reason I think that that might have been the case is that people had previously been exposed to what are essentially siblings of the current coronavirus, essentially related coronaviruses that commonly circulate in our communities and in communities across the world. And that our exposure over previous months and years to common cold coronaviruses, which scientists have known about for a very long time, our previous exposure to those viruses had essentially primed our immune systems in a way that we hadn't really appreciated, and given them the armor that they needed to be able to protect us better than we had hoped against the current COVID-19 pandemic. There is a lot of scientific evidence that's coming out of America and out of Europe at the moment that supports that hypothesis, and gives us evidence that would suggest that maybe our immune systems have been better prepared than we had hoped that they might be. But that may not be the only reason. It may well be that our community is younger than, for example, communities in Britain, which have been much harder hit in terms of deaths than our communities. And there may be many other reasons for why we have fewer deaths in South Africa. And this is something that we need to understand better in the weeks and months going forward.
Mm-hmm. And what about the areas? I know we were very concerned about people in high-risk areas and having to travel with public transport, and that would have not being able to social distance. That would have kind of made it easy for the virus to spread even more there. And could this have allowed the people to develop immunity, or the immunity to build up?
Yes, absolutely. And in fact, it turns out from the data that we're now gathering that the virus has really ripped through communities in a way that we hadn't previously understood. There's data now that has come out of the Western Cape and that is coming out of areas in Johannesburg that suggests that up to 40% of certain sectors of our country have been infected by this virus, and that they were infected in a way that left the communities pretty much asymptomatic. And what that means is that people were infected with the virus, but didn't become ill. Those people, although they didn't themselves become ill, will have developed some level of immunity to the virus. And that's what we're talking about when we talk about herd immunity, is that those 40% of people who have become infected by SARS-CoV-2 and have had COVID-19, though they didn't necessarily themselves feel ill, will have a level of immunity to the virus. And that means that as a community, we have much higher resistance to the epidemic going forward for the next months than we had previously thought. So many more of us in South Africa have been infected by SARS-CoV-2 than we had anticipated in such a short time. And that gives us as a country a higher level of immunity than we had thought existed in our communities.
Mm-hmm. Of course, this is wonderful news, but is it too early to celebrate?
Yes, I think we need to be cautious in interpreting this. What we do know is that people who have been infected with SARS-CoV-2, who have had COVID-19, have some level of immunity, but people who have been infected can be infected again. And so the notion that once you've had COVID-19, you'll be forever protected is certainly not true. No respiratory pathogen works that way. So as you know from flu, once you've had flu, you're certainly not protected from ever having flu again. And the same will certainly be true of the coronavirus. Just because you've had coronavirus once certainly does not mean that you will never have coronavirus again. If anything, we know that our immune responses to coronaviruses don't last particularly long. We hope that what our immune systems will do is make our later exposures, our next exposures to the virus, less severe. So people will become less ill, and that means that they will have less virus in them, and therefore there'll be less virus for them to spread to others. So we hope that the viral burden within the country will be less in subsequent rounds of infection. But there's no denying that this virus is going to be with us for a very long time. And as a country, we need to continue to wash our hands and to wear our masks. And we need those vaccines that we are all working so hard to test. And they're looking incredibly promising. South Africa really is at the forefront of testing those vaccines. We are doing incredibly well as a country in making sure that we will have access to the best data that we need to be able to bring those vaccines in. But in the meantime, we need to do the very basic things that we are doing so well as a country. We need to keep wearing our masks. We need to keep social distancing. We need to keep our windows open, which will become easier in summer, thank goodness. We need to keep doing the things that we have done so effectively for the last few months. As an example of how well this has worked, we have rid this country of flu, which is something that we've never done before. And that has happened only because we've been so careful in terms of preventing ourselves from infecting one another with not just the coronavirus, but with every other infectious agent. So we need to keep those high standards of hygiene. And in that way, we should hopefully be able to limit the spread of this virus, hopefully reduce the chances of a second wave while we wait for a vaccine, which will take some months, potentially years. But we need to be very aware of the fact that this virus is not going away anytime soon. This is a part of our fabric going forward, and we need to learn to live with it in a sensible way.
All right. So thank you so much for your time, Professor. And hopefully our listeners and viewers will continue to wash their hands, keep up with the hygiene, wear your masks wherever you go, sanitize as much as possible. And if you can stay at home, then stay at home. Thank you so much, Professor. Have a wonderful day.
Thank you. Thank you too.
That was a Professor Penny Moo from the SANTE Scientific Advisory Board member at Wits University and National Institute for Communicable Diseases. Yes, South Africans have developed an immunity to COVID-19, but that doesn't mean that there is room to celebrate just yet. As Professor mentioned, that they are still working on the virus and it could take up to 2 years. So while they do that, let us continue with the hygienic practices of washing our hands, sanitizing, and maintaining a social distance, as well as also having small gatherings. I know that people are super excited to go out and have a wonderful time with family and friends, but still keep your gatherings small because the smaller, the better. You are listening to the Maryam Mkwanda Show on Salam Media. We will be right back.